Gold participants from around the world. Welcome to Gold Learning. I'm Kristen Schwarz, licensed midwife and MC here for Gold Learning. And I have a very special guest with me here today. And we will be talking to Bianca Devsam about her upcoming presentation, Pain Assessment in Ventilated, Sedated, and Muscle Relaxed Neonates. Welcome, Bianca.
Hi, thank you for having me.
It's so nice to have you here, and we will talk about your presentation, of course. But before we get into that, can you tell our listeners where in the world are you located, Bianca? Where are you coming from today?
Yes, I am currently in Melbourne, Victoria, Australia. I'm located at the Royal Children's Hospital, and it's early morning here and very
Mhm.
dark and gloomy outside.
Dark and gloomy. So tell us a little bit about Melbourne in Victoria in Australia for the listeners who are, have never been to Australia. What would you say that, tell us a little bit about your area there.
Yeah, so Melbourne is known for its cafes and coffee, and we also have a lot of entertainment and like plays and theatres and shows, but also very sport orientated. It's a bit of a cultural kind of hub with lots of things to do. You will never get bored. I think a lot of Melburnians kind of say the only downside is probably the weather. We tend to be a little bit colder than the rest of Australia and more windy and rainy. But it's definitely, Melbourne definitely makes up for it with its culture um, and the people here are just great. It's a great atmosphere, great community. So yeah.
And wonderful. And you're coming today directly to us from the Royal Children's Hospital, right?
Yes, I am. I decided to record at the hospital today while I'm at work.
Uh-huh. Is it busy right now? Were you able to shut everything down and just be here, or was it a struggle? Are they as soon as they know that you're there, do they want you? Do they need you? And
Yeah, I definitely am not recording at my office desk, otherwise there would be a lot of distractions and noise. We're lucky and fortunate enough to have a learning precinct in on
Ah.
level one in the hospital. So I've booked a room here where it's a little bit more quiet and I'm a little bit more hidden, and hopefully there's no interruptions. Yeah,
So you're hiding.
I am hiding.
So tell us a little bit about the Children's Hospital, how big it is, what's going on there. And then I'll ask you also to expand a little bit. What is your role there and your background as well, your uh, professional journey?
Yeah, so the Royal Children's Hospital is one of the main tertiary centres in Victoria, in Australia. We care for the most sick and complex medical and surgical conditions in from babies to children up to 18 years old. Um, we have a variety of units, and we've also got kind of our own research. The Murdoch Research Children's Institute is kind of directly next to us as well. So there's a real integration of clinical with research and then education with the University of Melbourne also kind of situated close by. Yeah, so it's very it's a very big place, big scary place. When I first started here 5 years ago, I moved down to Melbourne and started working at the Children's Hospital in the neonatal intensive care unit. So we call it the butterfly ward. Each ward is kind of named after an animal. Um, so yeah, the neonatal intensive care unit is a level 4 tertiary NICU,
Hmm.
again caring for the most sick surgical medical conditions. We don't have a delivery ward here,
Hmm.
so all our babies are transferred to us by our emergency retrieval service, and or they're admitted through our emergency department.
Right.
And yeah, so we see some very interesting conditions. I'm always very challenged. every day at work. And even the conditions we do see all the time, each baby is very
Yeah.
different. Or sometimes we'll see a genetic condition that is so rare or that, I've never looked after before. It's always very interesting and very stimulating. You could never get bored here.
Mhm.
So yeah, it's a pleasure to work here and a lot of opportunities for growth, which yeah, I've taken up. Did you want me to talk through them as well?
Yeah, sure. Let us know a little bit
Yeah.
about yourself.
So, while I was here at the Children's Hospital, I've obviously done further study, and the Royal Children's Hospital offers something we call the best practice program. So it's building evidence to support and transform practice best. And basically, it's a program run by the Nursing Research Department here, which we're very fortunate to have. Every year, they take on board 8 nurses who have who have seen something in their clinical practice that is either a little bit questionable or maybe that we could be doing better in. And unfortunately, in pediatrics, sometimes a lot of things that we do, there is no evidence or not enough research on it. So the Nursing Research Department here through this program has supported clinical nurses to start building evidence to support their practice. And it can either support practice or change practice. So I applied for this program back in, I think 2016 now, 3 years ago, 3.5 years ago. Um, and I was successful in getting into the program, and that's when I started looking at pain assessment in neonates. And this is how this whole journey started. And I eventually went on to do my master's to kind of complete that little bit of research I had started with best practice. Um, I think my passion for pain assessment and even pain management in neonates definitely stemmed from my clinical practice and caring for these babies
Mhm.
in the ICU. And we're really good at some things and we're not as good or as strong in other things, and pain assessment and management was one of those things. And I very soon quickly learnt that we can't kind of improve on our pain management if we don't get the assessment part right.
Right,
So
right.
that's where I focused on for now.
Absolutely. Yeah. So tell us a little bit about the presentation, and thank you for sharing all your wonderful background and wonderful work that you're doing there. So important for sure. So your presentation will be specifically about pain assessment in ventilated, sedated, and muscle relaxed neonates. So expand
Yeah.
a little bit about it, on it.
Yeah. I think a lot of the research that currently exists kind of talks about there's lots of research on preterm infants, and there's a lot of research on term neonates even, and a little bit more healthy term neonates that are getting a heel prick maybe for a newborn screen test or an immunization. Like those are the kind of scenarios that babies are studied in the research that currently exists. But then in my clinical practice in the neonatal intensive care unit, I wasn't caring for those babies, or the preterm babies that we were caring for had surgery or a complex condition. And the term neonates that we were caring for, the most painful procedure they were getting wasn't just a heel prick or
No.
an immunization. And nurses, I found, struggled the most with this really sick cohort of ventilated, sedated, and must relax neonates.
Mhm.
So in my presentation, that's why I've chosen to focus on that group. Because even talking to nurses from other hospitals within Australia as well, everyone kind of manages these babies a little bit differently. We pain score muscle relaxed babies on our unit, but other units don't.
Mm.
And it's really unclear how pain is managed in that cohort in other units, and we definitely have a lot of room to improve on as well. So I kind of start off in my presentation with a review of the current literature that exists, and then move on to kind of some tangible or practical advice on how to pain assess these babies or assess pain in these babies. And then I kind of at the end present some of my research in this area to help back it all up.
Well, that sounds wonderful, and we can't wait to hear the presentation now. And
Thank
um,
you.
before I let you go here, real quick, my last question here. What are you hoping our delegates will take away from your presentation?
Yeah, I think one of the main things I want people to get out of this presentation is to be more mindful and aware of this really vulnerable population in an already vulnerable cohort of babies. But also to be a little bit validated that I actually don't have all the answers, and pain assessment in this group is really hard. And we all kind of have the same struggles in our clinical practice, and I've only done a little bit of work in this area, and just to start, hopefully this presentation starts people thinking about, oh yeah, that is an issue in my practice,
Right.
and now I can, I have some awareness around it, and how can we make it better, if that makes sense. I don't
Mhm.
think I necessarily have all the answers, but it's just trying to make people more aware of the issues, and then, some how we can kind of work through them the best we can at the moment. I think pain assessment in ventilated, sedated, and muscle relaxed neonates is not, um, there's no gold standard, it's not super clear, but we're just trying to do the best we can, and it's educating people on that. So hopefully they kind of learn more in that domain, feel a little bit more validated with their concerns, but have some things that they can take out of my presentation to help them in their practice.
Wonderful. Thank you so much, Bianca Devsam, for spending time here with me and answering my questions here today.
Oh, thank you, Kristen, for having me.
In the presentation Pain Assessment in Ventilated, Sedated, and Muscle Relaxed Neonates by Bianca Devsam is part of the Pain Management in the NICU lecture pack. And to our listeners now, for more information on this presentation and the other presentations in the lecture pack, please visit goallearning.com. Thank you everyone for listening here with us. Bye bye.